Hi, I'm Hasan Ali from Altınbaş University Istanbul College of Pharmacy. Our topic today is leadership and its effect on health management. Leadership in healthcare focuses mainly on achieving the goal of effective healthcare delivery as a team under the guidance of another team member. Leadership in health sector has become a key point in improving patient safety and health management as a whole. Healthcare and adequate management of medical facilities is a large issue facing the industry today. The role of leadership and leaders played within any organization is vital to maintain order and ensure processes and procedures are followed accordingly. The healthcare industry requires even more emphasis on the leadership styles employed within their facilities, as the lives of their patients are in the hands of the nurses and doctors that treat them. Historically, management and leadership styles were broad and not specific to an industry or sector. However, over the last few decades, with technology expanding at such exponential rate, the one-size-fits-all notion is no longer viable. In certain countries, a formal degree of education and knowledge is required to run a healthcare facility, whereas in other regions, the expertise required is not as developed, especially for development countries or those of middle-income states. The nursing profession, and by extension doctors and surgeons, have an extremely stressful job and can only function as well as the institution they employed in will allow. This requires that certain qualities and attributes be available in the leaders that are chosen to run hospital administration. There is examples of competencies, 5 methods of strategic thinking that adds value to leaders and their individual management styles has been shown. Like systems perspective requires a micro and macro perspective of front-end procedures as well as internal activities within an organization to understand the complex connection between each component that creates an interconnectedness to the functions that are vital to the business. This allows the leaders to know the end-to-end dealing of all aspects and provides a broad outlook on whether all the departments are efficiently working together. For example, in the healthcare industry, there are certain medical cases that require urgent surgery or attention, and this takes up either another room, bed, or operating room. A hospital manager needs to understand the intricate medical terminology and factors that would support the professional's decision to move a patient above another in order to provide emergency care. In some incidents, this is not always agreed upon between doctors and surgeons if more than one patient is in critical condition and will fight for their patient to be seen first. If more than one patient is in critical condition and will fight for their patient to be seen first. This instance is where hospital administration must intervene to mitigate the situation by determining the risks and threats imposed if one patient is operated on before the other. If for further clarity the former patient was scheduled for a heart bypass but another patient with multiple organ failure is rushed into the emergency room, the leader must use systems perspective strategic thinking to decide whether the heart bypass patient should be moved to another facility or is his condition stable enough. Intent focused is goal driven with specific aims in mind. A professional with this attribute can see the long-term focus of the organization and anticipate future changes in environment. The talks about the issue of technology advancement and a situation can be derived that hospital managers need to focus on the overall intent of their industry to provide continual healthcare services. If one cannot foresee the needs of the organization, is not focused on the end goal or does not adapt to medical progression, then the system fails in its overarching mission. Also, intelligent opportunism is the third installment of competencies in that a leader can evaluate new opportunities to adapt their strategies to evolving environments. Some studies show that most professionals can assess situations using strategic thinking method. Also, thinking in time refers to the ability to connect the present, past, and future together. That assists in understanding the gap between the current environment and the ideal one of the future. The method of strategic thinking allows leaders to make decisions about current events based on past experience. For example, certain seasons of the year have significantly increased rates of car accidents and suicides, such as Christmas and Thanksgiving. Administrators will do well to remember the past and stock up on medical equipment and medicine in expectation of these events, and even employing additional nursing staff would be advantageous. Hypothesis-driven strategic thinking refers to planning for the unknown future by testing assumptions. In order to plan for certain occurrences for the healthcare industry, it's important to anticipate any threatening event, whether it be a terrorist attack or a mentally ill patient that torments the other wards. You must have a contingency plan in place for such situations. Developing a global competency would ensure effective leadership styles and implemented in precise characteristics of the healthcare industry. Internationally agreed upon set of skills and foundational competencies are required for all healthcare managers. The core competencies must be used as a global framework to develop training and employment aspects of learning. Human resources managers should develop long-term pathways to direct careers for leaders in the health segment. Flexibility is considered in all aspects due to the fast-changing nature of healthcare industry, a control of peers and development based on the formalization of this category. As positive implications of effective leadership styles, we can notice in some reported studies that done over a span of 13 years, it shows that large improvement in staff collaboration and patient outcomes based on the facilities that implemented team building and communication exercises. The result shows the more communication and working together was enforced in healthcare facilities, decreases in morbidity and mortality rates and their expected outcomes were met more frequently. The connection here is that when employees, such as nurses and doctors, are happier in their profession, they want to perform better and take pride in their work. From minimizing work stress and employee depression through effective leadership skills, patient care is maintained at a higher degree of quality. If nurses are less stressed, fewer mistakes are made that could jeopardize expected outcomes. In all studies reviewed, it's widely recognized that certain leadership styles fit for the medical profession have a comprehensive and clear benefit to improving expected patient outcomes. An effective leader is one who can bring a team together to collaborate for the betterment of patients and the care they provide and is just as significant as having industry knowledge and experience. In many aspects of working environments, satisfied employees that are motivated to improve and want to develop themselves for personal advancement are just some of the reasons that communication is instrumental when managers are leading their team.
Thank you very much.